prevalence rate of autism, it's in a transition period right now. Just recently, the prevalence rate has been placed at anywhere between 1 and 150 children to 1 in every 94 children. So it's a little bit unclear right now exactly how many children do have an autism spectrum disorder. As of last year, the prevalence rate was 1 in every 250 children. What we do know is that the rate is increasing, and it seems to be increasing at an extremely alarming rate, and for reasons that are unknown at this point. We do know that there are a few things that can account for the increase, such as we have broadened the definition. So there used to just be classical autism, and now there's the pervasive developmental disorder component, and there's the Asperger's component. And years ago, when I first started learning about autism, it was thought that all children with autism had mental retardation, and we now know that children can be anywhere from the low range of mental retardation up through gifted. So we've broadened our definition, which automatically means that more children are going to be encapsulated in the diagnostic criteria. We also have gotten much better at identifying what is autism. People are better at doing the diagnosis at the moment. And so the better you get at diagnosing something, the more you're going to find, the more children you're going to be able to capture and find. And then the other thing is with the knowledge of how early symptoms of autism appear. Children have been brought to my clinic as young as 11 and 12 months of age when parents are already showing concerns. Another thing is that we know that children are actually being identified and diagnosed much earlier than they used to be. So in my clinic, children are being brought in as young as 11 and 12 months of age where parents already have concerns. So that means that children who might not have been diagnosed in the past until 4 or 5 years of age now might be getting diagnosed as early as 2, and even younger than 2. So then that also means that now we have more children on the younger end of the spectrum. However, even taking all of that into account, it still doesn't explain why the prevalence of autism has increased at the rate that it has. So, some states are reporting in a 10-year span that there's a 300% increase in the incidence of autism within their state. And every country, every place that actually records how many children have autism in their country, they're all reporting a similar increase. So there is something that seems to be leading to more children with autism actually being born. It can't just be that we've broadened the criteria and we're better at identifying it. But we really do not know for sure what the exact prevalence rate is. But it's going to be placed at about 1 in every 150 children, at least in the United States. One thing that has stayed relatively steady throughout all of the years of autism and looking at prevalence is it has always been more common in boys than girls. And that rate has stayed relatively the same, which is about 4 boys diagnosed with autism to every 1 girl. When you look at the higher functioning ends of autism, like Asperger's disorder, there seems to be even more boys that get diagnosed than girls. So sometimes the prevalence rate for boys versus girls with Asperger's is placed at about 10 boys to every 1 girl. However, that's thought to be more indicative of people not being good at diagnosing Asperger's in girls rather than probably a true distinction between the sexes for Asperger's disorder. But it is clear that more boys have always been and continue to be more affected by autism than girls.